our next guest, Dr. James Simmons. He's a hospitalist, nurse practitioner, and has served on the front lines during the pandemic. Good to see you as always. Tell us, what's your response to the CDC's new strategy for keeping kids in school? Should parents be worried about the increase in cases?
I think in terms of parents being worried about the number of increasing cases, it's something we should all be worried about, frankly. So, I think it's really important to point out with all of these new guidelines and everything going on right now, one of the things that we can't forget about while we look at Omicron in the future is that Delta is still very much here. Good news, though. We see and have seen proven for almost 2 years now that the incidence of cases in children might be higher, but in terms of the severity of illness with kiddos, it's pretty low. So it's not to say that it doesn't necessarily happen. Some kids do get very sick and some kids do die from this. But I think what's happening with these new testing protocols is that we know so much more about the virus. There are so many more adults and children in various communities who are vaccinated. And this gives us an opportunity to still keep people safe while also allowing children and really everyone and the entire school staff to stay in the school environment as much as we can. We learned so much throughout the entire pandemic about how, particularly for Brown children and families, sometimes remote learning had huge detriment to the learning process. And so this is another step that the CDC is taking to sort of give schools and school systems guidelines in how to keep kids and staff in school as long as possible. So the testing guidelines are a little bit confusing. I do encourage everyone to sort of, reach out to the CDC, go to their website to learn exactly how these testing protocols go. But I think what they're trying to do is strike this balance between keeping everyone safe and keeping everyone in the classroom.
Yeah, that's of course what people really are hoping for. Now, the 7-day average of daily deaths was up over 8% from last week. I think that people are concerned that we're going to start hearing about hospitals being overcrowded. We've already had reports of that. So many people sick that you can't even get your routine surgeries done, elective surgeries. What are your thoughts on how this new Omicron variant is getting people sick enough that we're seeing hospital overcrowding again?
Well, I think it's really important to sort of point out that, we're up over 120,000 cases per day right now, 66,000 hospitalizations per day, and more than 1,300 deaths per day. And as, the gentleman in the previous piece noted, Mr. Monroe from the Houston Children's Hospital, those incidences are still disproportionately impacting, marginalized communities like Black and Brown folks. And so that's driven by Delta. That's not even Omicron yet. So what we do know about Omicron is that is very much more contagious than previous variants. We also think, we're not entirely sure yet, the data is still a little bit out on this. We think the severity of illness with Omicron is even less. But when you look at the mass numbers of individuals who could potentially get sick from this, though, majority of folks are probably, we think, with Omicron going to have a mild illness or be asymptomatic. But think about those individuals who might be immunocompromised, older, be unvaccinated, and that puts them at higher risks. So it's less about that Omicron is more dangerous, more about that there's going to be so many more cases. We could already overwhelm health systems that in many states are already overwhelmed. Places like Wisconsin, for instance, issued a public alert today that they are simply at zero ICU bed capacity. There's lots of other states that are close to that, and that's driven by Delta. So I think it's really important for everyone to remember that depending on the community where you live in or where you may be traveling to for the holidays, Delta is still very much an issue. Healthcare systems are still very much overwhelmed, and we have to keep our eye on Omicron because cases are going to spike in a way we've never seen before soon in the next few weeks.
Yeah, absolutely, with the holidays here. Thank you so much. We appreciate all of that great advice and perspective. Take care. Today, President Biden returned to South Carolina, a state that played a pivotal role in helping him secure the White House. President Biden delivered the commencement